Hello everyone, in this video we'll discuss about alcoholic liver disease. So what is alcohol? Alcohol is a psychoactive substance which leads to alcohol dependence and causes certain physical, psychological and social problems. So excessive alcohol consumption can lead to alcoholic liver disease. So alcoholic liver disease is not a single entity. It contains a spectrum of diseases which are steatosis, that means the fatty liver, then hepatitis, fibrosis, cirrhosis and hepatocellular carcinoma. I have already discussed about cirrhosis in a separate video in detail and steatosis also. In this video we will also discuss about them, but briefly we will discuss about this. So going to firstly the intake of alcohol and its effect on the body. So if it depends upon the duration as well as the amount the person is consuming. So if there is a short term ingestion of around 80 grams of alcohol for several days, it can produce a reversible hepatic steatosis. If it's a daily intake of 80 grams or more of alcohol, it can lead to severe hepatic injury. And if this amount goes up to 160 gram of more for around 10 to 20 years, it will lead to a very severe injury. Important thing to note is that around 10 to 15% of alcoholics, of total alcoholics, they only develop cirrhosis. So other factors such as the ethnicity of the person, such as the genetics, the family history, they also play a role while uh, in alcoholic liver disease. Now going to the spectrum of alcoholic liver disease. So the three major uh, diseases, the disorders which take place in alcoholic liver disease, they are firstly hepatic steatosis, that is the fatty liver disease, then alcoholic hepatitis, that is the inflammation of the liver itself, and then the cirrhosis. Okay, so going to firstly we will discuss about the morphology of various spectrum, then we'll go to the pathophysiology. Going to firstly the morphology of fatty liver. So what happens is there is accumulation, there is intracellular accumulation of the fat, the lipid droplets within the hepatocytes in case of fatty liver. So what happens is, if this is the hepatocyte and this is the nucleus, so firstly the intracellular accumulation takes place in the form of microvesicles. So this microvesicle will not displace the nucleus of the hepatocytes, and this is known as microvesicular form of lipid deposition, and this appears firstly in the perivenular region, that is the zone 3, that is near the central vein. This is the first deposition of lipid is seen. Then after chronic intake of alcohol, what happens is there is macrovesicular vesicular globules. Now these globules, they displace the hepatocyte nucleus to the periphery of the cell. So this is known as macrovesicular form of lipid deposition. I have already also discussed steatosis due to other diseases also in a separate video. You can watch that. We have discussed about the morphology in detail also there. So macroscopically, how will liver or fatty liver look like? It will be large because there is intracellular deposition. Then it will be greasy because of fatty deposition, and this will be a little soft organ rather than a firm organ. It will be yellow, greasy. Okay, so in itself fatty liver there is no fibrosis, but if the alcohol intake continues, then fibrous tissue can develop. Okay, also important thing to note, a very important thing to note is that fatty change in itself is completely reversible. If the person abstains himself from the alcohol, this change is completely reversible. Now going to the second spectrum, that is alcoholic hepatitis. Now what are the things which morphologically you can see in hepatitis? Firstly is the hepatocyte swelling and necrosis. So what will happen is the single or scattered hepatocytes can undergo swelling, that is known as ballooning, and can undergo necrosis. Okay, now why they will go ballooning? Because there is deposition of fat, the deposition of water, and certain proteins which were normally exported from the hepatocyte are not being exported. So because of that, there is ballooning as well as necrosis takes place. Also, there can be mild deposition of iron within the hepatocytes and Kupffer cells. Now, second thing, very important, is the presence of Mallory bodies. So Mallory bodies, you can see here, eosinophilic material. This is known as the Mallory bodies. So what are Mallory bodies? So scattered hepatocytes, they accumulate tangled skins of the cytokeratin of intermediate filaments such as cytokeratin 8, 18, ubiquitin. So these depositions, they can be visible in the hepatocyte as eosinophilic material. Okay, so this is known as Mallory bodies. Now Mallory bodies are very characteristic of alcoholic hepatitis but can also be seen in certain other diseases such as non-alcoholic fatty liver. You can see in Wilson's disease, in hepatocellular tumors, also in chronic cholestatic syndrome, but they are very characteristically also seen in alcoholic hepatitis. Now, other findings seen in alcoholic hepatitis is the, because it's the inflammation, you will see inflammatory cells such as neutrophils are seen over here. So neutrophils, they permeate the hepatic lobule and they accumulate mostly around the degenerating hepatocytes, and certain hepatocytes, they which contains Mallory bodies. So their neutrophilic reaction can also be seen. Then fibrosis. So alcoholic hepatitis can also be accompanied by activation of stellate cells. So if you want to understand more about stellate cell, watch the video in which I have discussed about cirrhosis. Okay, so the activation of stellate cells and the portal tract fibroblasts, they cause fibrosis and then leading to finally cirrhosis. Now, going to cirrhosis, the third spectrum of the alcoholic liver disease is cirrhosis. Now, cirrhosis is the irreversible form of injury. It is not reversible. As we discussed in fatty liver, it was reversible. Hepatitis, that is reversible. But cirrhosis is the irreversible form of injury. Mostly, it evolves very slowly. Okay, but in some cases it can also develop in 1 to 2 years also. So it varies according to the person to person. So in detail, we are not discussing cirrhosis over here. It's itself a very big topic. I have discussed that in separate video. Okay, so initially the fibrous septa which develop, they are very delicate, but with time they will become prominent and they form micronodules. So how are micronodules formed? There is uh, hepatocyte death is taking place, then fibrous septa are forming, and along with that there is regeneration of certain hepatocytes. Okay, hepatocyte, the liver tries to regenerate itself. So because of this all things which is going on, micronodules are formed and they give a very characteristic hobnail appearance to the surface of the liver. Also, in case of alcoholic liver disease, both micronodular and macronodular pattern of cirrhosis is seen. Along with that, there is ischemic necrosis and fibrous obliteration of the nodules that leads to a very tough pale scar tissue. This is known as the renic cirrhosis. So I will suggest you to watch the video on cirrhosis itself, because by that you will understand what is how cirrhosis pathophysiology is there. Okay, and about the patterns you will understand in detail over there. So cirrhosis, either it is due to viral hepatitis or alcoholic hepatitis, they all will have at the end same thing. Okay, so cirrhosis morphology also in detail we have discussed in that video only. So going to the pathophysiology. So going to the pathophysiology. So pathophysiology, the alcohol works by multiple methods by which it causes shunting of normal substrates away from the catabolism and towards the lipid biosynthesis. So it increases the lipid biosynthesis and causes fatty liver. Okay. So first method by which it acts is by excessive NADH generation. So how does this work? So what happens is alcohol is converted by alcohol dehydrogenase to acetaldehyde. and by acetaldehyde dehydrogenase to acetate. Okay, so what happens is the NADH production is increased. Okay, so this NADH, this itself causes, firstly it inhibits the fatty acid oxidation, it causes increased fatty acid synthesis. So this NADH has first role which increases the lipid biosynthesis. Then going to the second method by which alcohol affects is by cytochrome P450 inductions. So by cytochrome P450 induction, what happens is alcohol act as a uh, uh, induction for this, and reactive oxygen species, the free radicals, they are formed. Free radicals are formed, reactive oxygen species, they are formed, and they can again cause damage to the protein and membranes. Then alcohol also directly affects the microtubular and mitochondrial function, which leads to immunological attack on the hepatocytes. Then a very important method is acetaldehyde. So acetaldehyde we already discussed. From the alcohol is converted to acetaldehyde. So acetaldehyde also causes lipid peroxidation and acetaldehyde protein adduct formation. So this is important. Acetaldehyde causes protein adduct formation. And lastly, it also leads to uh, stellate cell activation, which will further lead to cirrhosis. So these are all the mechanism by which alcohol acts, and the pathophysiology works of alcoholic liver disease. Then one more thing that is important is the gut bacteria. So when a person consumes alcohol, it leads to translocation of the gut bacteria to the portal system along with the lipopolysaccharides. Now this leads to again increase in the inflammatory and immunogenic mediators, because these bacteria were supposed to be present in the gut, but now they are present in the portal system. Okay, so this will again lead to increased inflammation and immunogenic mediators such as TNF alpha, interferons, and will cause a inflammatory state of the liver. So in summary, if we want to summarize, so alcoholic liver disease is a chronic disorder which features steatosis, hepatitis, fibrosis, cirrhosis, and there is also derangement of the vascular perfusion. And alcohol itself is not a very harmful chemical, but because of the response of the body to the alcohol, this is actually a maladaptive state in which the cells of the liver, they respond in very pathological manner to a stimulus that is not that much harmful itself. Now going to the laboratory findings. So laboratory findings, firstly you will find there will be anemia. A patient will have anemia. So anemia can be of macrocytic type. Okay, then there can be hypoproteinemia can be seen. Globulins can reduce, albumin can reduce, there is reduction of the clotting factors, because these all are produced in the liver. Then there can be increase in the bilirubin level. Then in enzymes there can be elevation of the alkaline phosphatase, there can be elevation of the transaminase level. So transaminase level, there are two types. Okay, there is one known as aspartate aminotransferase, then there is alanine aminotransferase. In case of alcoholic liver disease, aspartate is more than alanine aminotransferase. However, in other liver disease, whenever transaminase levels increase, there is increase of alanine aminotransferase more than aspartate. Only in case of alcoholic liver disease, aspartate one increases more. So what is the prognosis? What is the at the end stage alcoholic liver disease? What are the proximate causes of death? Okay, if there is steatosis, if there is hepatitis, the things are reversible. Okay, that is another thing. But if the progression takes place. Okay, so it can lead to hepatic encephalopathy and hepatic coma. It can lead to, because of portal hypertension, it can lead to massive gastrointestinal hemorrhage. It can lead to infection. It can lead to hepatorenal syndrome, and it can also lead to hepatocellular carcinoma. And around 1 to 6% of person developing alcoholic cirrhosis, they go into hepatocellular carcinoma. So these are the end stage causes of death in case of alcoholic liver disease. This was all about the alcoholic liver disease. Ask your queries in the comment section. Do watch also cirrhosis and steatosis videos. Uh, they are there I'm discussing that topic in detail. So thank you.